Morning, APOSI peeps! Welcome back to our Wednesday Wellness webinar. So today, we will be tackling about something to do with our neck or our throat. It's a vital organ also in our body that will help us to function every day without any interruption. So let me share my screen. So our topic for today is hyperthyroidism. So it is a butterfly shape. So makikita nyo siya, it's a 2 to 3 inches under your Adam's apple if you are a male. Sa mga female naman, itry nyong lumunok and you have to palpate it here banda. Pag may nahawakan kayo, yun na yung thyroid gland natin. So what are the functions of our thyroid gland? So the thyroid gland, mainly, nagsisecrete siya ng thyroxine, which is the T4. So yung T4, it is responsible for heart pumping, digestion, muscle contraction, bone health, and brain function. So if you can see on the screen, almost parts or major parts of the body yung pinoprovide ng T4, which is also active siya or magiging function or magiging improve yung function niya sa T4 kapag kasama niya naman si T3. So with that, we will be tackling hyperthyroidism, which is known as overactive thyroid. So it occurs when your thyroid gland produces too much of the hormone thyroxine. So it can accelerate your body's metabolism, causes an intentional weight loss, and a rapid or irregular heartbeat. So what are the symptoms if you have hyperthyroidism? So number one, intolerance to heat, fine straight hair, and then bulging eyes, facial flushing kasi nga you cannot tolerate heat, and then enlarged thyroid. Dito, enlarged siya na to the extent na para na siyang malaki. Unlike with the goiter, yung goiter kasi meron talaga siyang visible na lump dito sa may banda. Pero yung enlarged thyroid, hindi siya visible masyado sa mga leeg natin. And then tachycardia or increased heart rate, and then systolic BP, and then breast enlargement, weight loss kasi nga mabilis yung metabolism, and then muscle wasting. So there's a tendency na papayat ka, it's because of the metabolism na meron ka. So kung kakain ka, mabilis mo ding madigest yun. And then localized edema kapag long-term na yung hyperthyroidism. And then menstrual changes. So amenorrhea, sometimes hindi ka magkakaroon ng menstruation for 2 to 3 months or 2 to 4 months, mga ganon. And then, diarrhea, tremors, and finger clubbing. Mamaya ang tremors, explain ko during the diagnosis pa na it's one of the identification na, na mayroon kang hyperthyroidism. So what are the causes? So Graves' disease, that is an autoimmune disorder that causes antibodies to stimulate too much hormone of thyroxine. So ang Graves' disease, ang tawag sa kanya kapag namana natin yung hyperthyroidism ng parents papunta sa bata. And then one other cause is benign tumors of the thyroid or pituitary gland. So pituitary gland, part siya ng brain na kung saan siya yung nagre-regulate ng hormones or lahat ng hormones natin. So pag merong tumor dyan, may tendency na maapektuhan yung thyroid or thyroid gland or the thyroxine na hormone. And then thyroiditis, so that is simply an inflammation of the thyroid, so which causes T4 and T3 to leak out of the gland. So kapag namamagay thyroid gland, there's a tendency na maglilik yung thyroxine. So mas maraming thyroxine na hormone na meron sa bloodstream natin. And then excess iodine consumption. So ika nga, too much is not healthy. So kapag sumobra naman tayo ng iodine intake, so there's a possibility na magkakaroon tayo ng hyperthyroidism. hyperthyroidism. And then large amount of thyroid hormone intake. So kapag thyroid rather, there's a tendency na lifetime na yung pagtitake nila ng hormone. Kapag nasobraan naman sila noon, so there's a tendency magkakaroon sila ng hyperthyroidism. So diagnosis, so before tayo mag-jump into conclusion na meron akong hyperthyroidism, of course, you will consult a doctor, you will consult a specialist na mag-check sa'yo. Physical exam, so slight tremors in your fingers when they're extended. So, meron silang ipapagawa sa'yo niyan. And then, kapag yung dalawang kamay mo, nag-straight siya ng mga at least a minute, tapos may slight tremor, so there's a tendency may hyperthyroidism ka niyan. And then, overactive reflexes, and then eye changes. So, bulging eyes, that's what I mentioned earlier, warm and moist skin kasi nga hindi mo nato-tolerate ang heat, and then enlarged, bumpy or tender thyroid gland, and then rapid or irregular pulse. For the blood test naman, they will use thyroxine test para makita nila kung above normal yung thyroxine na hormone na meron sa bloodstream, and pwede din yung thyroid stimulating hormone test. And then kapag gusto talaga nila ng deeper na diagnosis to confirm, they can use also radioiodine uptake and thyroid scan. So si patient, iinom siya ng iodine, pwede din siyang injection. And then magsa-scan siya doon mismo sa thyroid gland, and titingnan nila kung gaano kalaki yung thyroid gland at ilang centimeter na siya, and kailangan na ba siyang operahan o hindi. And then thyroid ultrasound. So parang ultrasound lang yan siya na normal sa like abdomen, and it will also check the size of your thyroid gland. So what are the foods to avoid? Syempre, kapag may hyperthyroidism ka, you are not allowed to eat iodized salt. Kasi kapag kumain or uminom tayo ng mga beverages na may iodized or iodine, hindi na yan mapaprocess ng thyroid gland natin. It's because defective na yung thyroid gland. Fish and shellfish, so mga lamang dagat, so hindi na siya po pwede. It's because masasayang lang. So yung symptoms mo for palpitation, metabolism, mga muscle wasting, mas mag-progress yon kapag kinain mo yung mga katulad nito. Seaweed or kelp, lamang dagat din yan. And then food products containing red dye, katulad ng mga, kahit mga colored foods na red, yung red dye kasi meron siyang iodine content. So, hindi siya po pwede. And then dairy products like mga yogurt, mga flavored milk, hindi na siya po pwede if you have hyperthyroidism. So, what are the foods that you can eat if you have hyperthyroidism? So, of course, kailangan ibabalance natin yung pagkain also natin aside from the medication. So, low iodine foods. So, hindi po pwedeng yung mga mention ko nga kanina. So, I'm sure your doctor will give you a meal plan for that. And then, cruciferous vegetables like Brussels, cabbage, broccoli, cauliflower, pwede siya. It's because tinawag siyang cruciferous kasi nga it can decrease the amount of thyroid hormone in your thyroid gland produces. So, it can help you to at least normalize or balance yung excess na thyroid hormone mo or the thyroxine. And then foods containing selenium. So, ang selenium is good for prevention ng cell damage, and it will keep your thyroid gland to be healthy. Sa food containing iron naman, of course, it will help us to have a good oxygenation also sa blood kasi kapag wala tayong iron, there's a tendency na magkakaroon tayo ng anemia. And then foods containing calcium and vitamin D, it's because these vitamins are good for bone growth, bone health, and bone development. So we need to eat that kasi nga kapag defective yung thyroxine natin, so there's a tendency naman kapag sobra, hindi na makukuha ng katawan natin. And yun nga kanina sa signs and symptoms, there's also a defective for your may edema ka na, meron ka pang mga muscle wasting. So lahat ng sobra nilalabas lang ng katawan mo. And then spices, turmeric and green chilies. So yung mga spices na yan, meron siyang anti-inflammatory effect. And aside from adding flavor, it also add a dose of antioxidants. So nakakatulong din siya to at least help you to neutralize yung thyroxine level sa bloodstream natin. So what are the treatments? So of course, radioactive iodine. So that is taken by mouth, ma-absorb siya ng thyroid gland natin at it helps your gland to shrink. So, pinapaliit niya. However, meron siya mga side effects that will last for 2 to 3 months kasi nga yun yung effect niya. So, it will slow down the activity of your thyroid gland. Anti-thyroid medication that is to reduce the symptoms of your hyperthyroidism, and it helps also not to produce more than the amount na kailangan ng katawan natin ng thyroxine. And then beta blockers. So beta blockers, this is used to treat high blood pressure. And kahit hindi siya nakaka-affect ng thyroid levels, however, it will help you to at least alleviate the symptoms of hyperthyroidism like tremors, rapid heart rate, palpitations, yung increased systolic BP, mga ganon. And then if hindi na talaga siya mama-manage sa mga ganong treatment, sa simple medication, pag pregnant, there's a tendency na mahihirapang manganak si patient kasi nga lalala yung hyperthyroidism niya. The remedy for that is a surgery that is called thyroidectomy. So removal of your thyroid gland. Sometimes partial siya, sometimes buo siya. And kapag natanggalan ka na ng thyroid gland, there's a tendency na you cannot, or your body cannot secrete any thyroxine anymore. So, ang mangyayari dyan, you will be getting lifelong treatment with levothyroxine, that is an artificial or synthetic thyroxine hormone na kung saan it will help um, your heart to pump, yung digestion mo, yung muscle contraction, bone health mo, siya na yung magpo-provide in replacement of your thyroid. It's because natanggal na siya. And thank you. So, do you have any questions or clarifications, guys? So, if not, next week, our topic, that would be hypothyroidism. So, kabaliktaran naman siya ng hyperthyroidism. And if you don't have any questions, then you can send us a message to APOSI Clinic team if you have any suggestions or topic that you want us to discuss. So, thank you for your time, guys, and have a great day. Bye!